Now, unlike lying in the comforts of your sofa in your living room, standing on your compound, or even sitting in your car to make or receive that pressing phone call, residents of Asem in the Awen municipality of the Western region ought to be at the cemetery to receive or make phone calls. The cemetery is the only place the residents are assured of a clear and reliable network connectivity. Correspondent Inathalia Kwanta has visited the community and reports.
For many people, the mere mention of cemetery evokes thoughts of ghosts. So, it is the last place anyone would wish to sit and have a good conversation. But for the past 16 years, the cemetery and this particular grave is the only place to get telephone connectivity. Asem is one of the many communities in the Awen municipality without a telephony network. Residents say about 85% of the municipal land area is all a dead zone when it comes to connectivity.
Well, as you can see, I'm busy with my phone and I'm here because of network. This is the only area that you can get access to network. So I'm here for network. For calling someone with a phone, I mean, you should have been in your room anywhere you want to. But then this time, here it's not like that. You have to, travel or go somewhere else. Apparently, we have another joint at the top there. It's either you go there or you come here. So it's very difficult, very sad. As you can feel the smell, it's very sad. You can imagine when you want to call somebody in the night, coming here in the dark. It's a pity.
Though there are 2 network connectivity spots here, serving the over 1,000 residents, it is clear they prefer the cemetery to climbing of a tree.
There is only 2 places in this place. One is the cemetery and the other place is unless you go and climb a tree. And that is very, very risky. If you don't want to pass through that method, then this is the only place that you can come. And then this town is a very, very large town. Where I'm even coming from to come and sit here to make a call is even far from this place, but I have to come. And I believe you don't want me to go and climb a tree because that place is very risky. Basically, it has been on existence because since I was born, this situation has been here. And I'm even getting to 25 years, so I would say it has been on existence.
From the cemetery, I went to the second spot, and it was amazing to see how phones were tactically leaning on this almond tree, while some residents enjoyed their calls on the trunk of the tree. Their demeanor can best be described as fear and happiness.
There is a network problem. Papa. Network.
Our network is our biggest challenge, coupled with our poor road network. 10 years ago, some network giants came around to give us promise of fixing it, but they never returned after they left. We always have to climb this tree, and even that, calls aren't clear.
Omape is another community which is supposed to have a good network connectivity, but it will take an hour to get there. I met 25-year-old Akwesi, who tells me he's losing his fiancée to someone in Kumasi because of the network connectivity problem.
I can't call my fiancée because of the network problem, and even if I get the network, I'm not able to tell her any secret because it is an open space. There are no secrets when making phone calls. I was in Kumasi with my fiancée and I decided to come back to my hometown. Now, I wanted to come here, but how to even give direction to her is now my headache.
It's obvious access to mobile network is a big problem in parts of Ghana, and this part of the Western region is no exception. Reporting for Joy News, Inathalia Kwanta, Asem, Western Region.
Now, away from that, at the shopping mall, school, law courts, banks, and other places where many converge to access a particular item of value or service, it's common to hear phrases such as first come, first served, and the early bird catches the worm. They are usually used to promote fairness and organize people to avoid chaotic situations. Well, in emergency cases, those who came last may be served ahead of those who came before them. How so? Matilda Omega looks for answers in this Joy News Health Desk special report.
At every point in time, whether morning, afternoon or night, there's a critically ill patient requiring more than the normal interventions from the emergency services staff to stay alive. Similar to a busy restaurant, if it's packed, there's going to be a longer wait line. Unlike a walk-in, an emergency room is not a first-come, first-served place. Emergency department professionals have to determine the severity of a patient's ailment and recognize if they need medical attention urgently, and they do this with a process called triage, which simply means to sort. This process is what sometimes accounts for the long wait in the emergency room, leaving people frustrated and angry at health professionals. Emergency physician at the Greater Accra Regional Hospital, Dr. Edem Komla Nani says, whilst waiting for medical attention may seem tedious, it is important for people to understand the process.
The reality of the situation is whenever you arrive in the hospital, you are not the only person to be taken care of. When it comes to emergencies, every second is of utmost importance. Every second counts. A patient could lose a life if care is delayed for a while. So what we do in the emergency room is not about first come, first served. We have a formal triaging system that we use, which helps us to tell whose illness is more severe than the other, so that we can take care of the more severely ill people before we get to the less ill people. So yes, that to some extent brings dissatisfaction for those who are less ill, but then in the long run, it actually brings the most good for the most people, in that at the end of the day, we get to save the most lives. And because sometimes the communication may not be as good as it should be, the understanding isn't there. I think the other thing we may have to improve is the communication with our patients, so they understand that it's not about first come, first served, but whose illness needs the most urgent attention.
But the procedure from pre-hospital care through to the emergency room can be daunting, with lots of possible outcomes running through your mind. At the moment, the country has between 50 and 60 functional ambulances. The widening gap for pre-hospital care, transportation through to the emergency room, where the no-bed syndrome continues to claim lives, remains a big issue in the health sector. At the Greater Accra Regional Hospital, a department is dedicated to emergencies. Dr. Emmanuel Sropenyo is a medical director.
We have put in place a series of strategies. One of them is to set up what we call bed management committee. And so this is a team of doctors, nurses, and administrators. And then their job is to go around the hospital or the walls and make sure that wherever there is bed, they mark it, that there is a bed here. And then when the emergency department is getting full, then patients are transferred to those places so that at all times we have bed at the emergency department. Another system strategy we put in place is what we call functional usage of bed. You know that in the past there are some departments that may be busier, or sometimes their patients stay longer. For example, the medical department, the patients tend to stay longer because these are elderly people who may have stroke and the rest, so they don't go home, compared to some other department that they come for surgery, your surgery is done, you go. So sometimes there are beds in some department and there may not be beds in another department.
CEO of the Ghana Ambulance Service, Dr. Ahmed Zakaria, says whilst the service awaits to take delivery of the 270 ambulances promised by government next year, there is an urgent need for schools to train people in basic first aid.
We can bridge the gap by training what we call volunteers and first responders within the communities. You know, if you go to many developed countries, every average person within the community is trained in basic life support skills. So when that happens, even in the house, the individual is able to start some first aid before they send for the emergency services to arrive. So we should be able to get into the communities, target the communities, the drivers, the schools. But I would even recommend that we catch them young, and therefore we should be able to include in our curricula first aid training. So that once we know that every child is trained in some basic life support, the child grows with it.
Meanwhile, the Greater Accra Regional Hospital has taken delivery of advanced support ambulance with equipment and medications on board to deal with emergencies. For Joy News, Matilda Humaga, Accra.
Now, Cabinet has given approval for the construction of 10 coastal fishing harbours and landing sites for the fisheries sector. Parliament is expected to subsequently approve the $235 million project to be located in selected regions. Speaking at a midweek press briefing, Information Minister Kojo Oponkroma stated the construction of the facilities are in line with the NPP government's vision of transforming the fisheries industry. The project, amongst others, is expected to prevent and minimize post-harvest losses and also add value to fish caught by artisanal fishermen.
The 10 identified sites where the landing beaches will be constructed are Teshi in the Greater Accra region, Axim in the Western region, Dix Cove in the Western region, Elmina in the Central region, Winneba in the Central region as well, Mumford in the Central region, Senyabreku in the Central region, Fetegoma also in the Central region, Muri in the Central region, Keta in the Volta region. The development of the fish landing sites and ports is aimed at ensuring safe launching and landing of particularly artisanal fishing and canoes. It's also aimed at creating and maintaining a hygienic environment for the processing and the handling of fish, preventing and minimizing post-harvest losses and adding value to the fish caught by artisanal fishermen. Ladies and gentlemen, the fisheries sector plays a major role in the Ghanaian economy. It contributes about 3% of our GDP, we are told, and also has significant indirect contributions to the economy. And these include employment opportunities for marine fishermen, boatyard workers, suppliers of auxiliary goods and services, and exporting of the fish products to earn foreign exchange for the country. One of the significant expectations we have when these fish landing sites are completed is that about 12% of our total national fish stock, which is currently exported, will go up. And the completion of this project is expected to increase export volumes and directly increase the foreign exchange earnings of the country. There is an 11th landing site or fishing harbour that is to be constructed, but that is not to be constructed under the commercial and financing agreements that are currently before Parliament. That is to be constructed with a grant from the Chinese government, and that is the Jamestown Fishing Port Complex project. We have secured a grant for that one. That one doesn't, of course, require parliamentary approval, so you won't find it in the list that is going to Parliament.
Still watching Joy News today. I am Daniel Dazo. We're going to take a few messages, but before that, the Information Minister has also been speaking on the railway sector. He says it seems a major rehabilitation works in less than 2 years. That's the Akufo-Addo-led administration has been in office. What more has he been saying?
On the Eastern Line, the Ghana Railway Company Limited, with its own workforce, commenced rehabilitation works on the 70-kilometer narrow gauge section of the Eastern Railway line from Accra to Nsawam and Accra to Tema. Rehabilitation of the Achimota to Tema section of the line is approximately 90% complete, and test runs have already commenced on that line. It's our expectation that once we are done with the test runs and it's fully certified to commence full operation, then we'll open it up for full operation. Work is ongoing on the Achimota to Accra Central section of the line and the Achimota to Nsawam section of the line, and this will be completed before the end of 2018. 10 existing passenger coaches have also undergone refurbishment and will be put on that line once it's completed and certified for work. This is expected to enhance passenger comfort when the suburban commuter service reopens on this line. We are also working towards constructing a new standard gauge along that line. The procurement process to develop a new standard gauge for the Eastern Railway line with a distance of 340 kilometers is also ongoing. This from Accra, Tema to Kumasi, with a branch line from Bososo to Chibi. 8 consortia have submitted their final bids as at October 11, 2018, and government will complete negotiations with the most preferred concessionaire before the end of this year to develop the project on a build, operate, and transfer basis. Let me also update you on the Central Line. And feasibility studies have been undertaken by government on the proposed 596-kilometer greenfield railway line from Kumasi to Paga. That's what we call the Central Line. The construction of the line will be undertaken in sections: Kumasi to Buipe section, Buipe to Tamale section, Tamale to Paga section, with a branch line from Tamale to Yendi. This is significant because it will be the first time since 1898, when the British introduced the railway into the then Gold Coast, that the railways will go beyond Kumasi. And the president promised that this will get to Paga. That was his vision. And this is an update of where we are in fulfilling that vision.
Still watching Joy News today with me, Daniel Daze. We'll take those important messages now. Thanks for staying with us. Now, a senior lecturer at the School of Public Health at the University of Ghana, Dr. Maoli Jojo Menyo, has called for a new paradigm in research in the country to inform policy and practice. He said the paradigm shift should be such that inputs from local people on what the issues are that would inform the formulation of research questions. Then you can have a meaningful research that actually addresses the problems at a local level.
Speaking to Joy News on the sidelines of a building research capacity for sustainable water and food security in sub-Saharan Africa Brescia project for stakeholders in Tamale, Dr. Jojo Menyo said the project is to help build the capacity of researchers in 3 African countries to conduct impactful research to inform policy decisions on water and food security.
So this project is called the Brescia project. It is actually conceptualized to improve research capacity in 3 sub-Saharan African countries, Malawi, Ghana, and Kenya, so that we can carry out impactful research to inform policy on water and food security. Okay, what informed the decision is that we've noticed a gap in research that would inform policy and practice. Before you can inform policy and practice, you must conduct research in such a way that the research is meaningful. It must provide that evidence for you to change policies. So, in the first place, we need to develop the capacity of the researchers. We also need to develop the capacity.
Still watching Joy News today. Now, teachers in the country's colleges of education have rejected talks with government over market premiums and allowances following the state's freeze of their salaries. Government has resolved not to pay November salaries of the striking teachers in the various public teacher trainee colleges in the country over what is described as an unwarranted and illegal strike. The teachers have since the October 29 stayed away from the classrooms over issues with their market premiums and book and research allowances. Let's go over the phone lines now and speak to Erastus Asaridonko, who is covering the press conference by SETAG in the Ashanti region. Erastus, what does SETAG need now?
Well, so SETAG is saying, just like your intro said, they think that if government decides not to pay their November salaries and not to pay them any salary for as long as they will be on strike, that will be procedurally wrong. They feel that the only institution that could assess their strike and declare it illegal and come out to say that they have to forfeit their salaries during the strike period is the National Labour Commission. And the National Labour Commission has not made any such.
Now, Erastus, we know they were supposed to meet the Labour Commission. Right. Erastus, we lost you there for a moment, but we know they were supposed to meet the Labour Commission, that is SETAG. Will that happen?
Yes, they are saying that they recognize the National Labour Commission as the powerful institution backed by a high court capacity, and so they will meet the National Labour Commission tomorrow and articulate their views. But they will not sit down with any government official until their November salaries have been paid. And that is what they are saying now.
But have you been to some of the colleges of education? How would you describe the atmosphere?
Well, currently I'm at the St. Louis College of Education located at the heart of Kumasi, and I can see students going into the dining hall for their meals. And so currently they eat and sleep. They take their meals, go back to their dormitories. Some of them who have other things to do also go. Some of the continuing students who need supervision at the moment and are doing their practical work outside have been going without supervision. Some of them are also loitering around. Some of them rehearsing for entertainment periods and all that. So it's an empty campus, just to say the least.
Now, thank you very much, Erastus Asaridonko, for that update. Will be coming to you when that meeting with the Labour Commission happens tomorrow. Now, the Council for Scientific and Industrial Research, CSIR, says it has set up a team of experts who will come up with strategies to combat the viral diseases affecting cassava in some parts of the country. Director of the CSIR in charge of the Crops Research Institute, Dr. Stella Enin, stated that the West African Epidemiology Project will assist experts understand and develop a national response plan to control the virus spreading in Ghana. Joshua Smith has more.
In 1990, cassava brown streak disease infected some cassava farms in Uganda and Tanzania, wiping many farms, causing famine. But today, Dr. Stella Enin says enough sensitization must be done for farmers and consumers, adding that this will help them identify the various viral diseases in cassava on farms and markets in Ghana.
These are key stakeholders who can bring their ideas together and their experiences to ensure that this disease is contained and not even brought into the country. Because the disease is very devastating, and if it comes into a country as it did in Eastern Africa, Tanzania and Uganda, they lose all their cassava planting material, and new materials have to be bred to replace the existing ones. So we will ensure that it doesn't happen in Ghana. How we can prevent it is, first of all, to sensitize everybody, especially farmers and consumers, to be able to identify the disease in the first place. Because if you don't know it, how do you even manage it?
Echuma Apimanimhene Nanafobi Cropper III tasked experts to devise means of educating farmers on the different signs of the viral viruses on cassava.
I think if there was a system where, say, when we meet Kumasi Traditional Council or any other traditional council, you, the experts, to take advantage, to sort of educate us. I think it will be a very effective way of we carrying the messages back to our people. because the way we organize things in this country, we seem to have certain set ways. You go to the media, you hold your press conference, you do your press releases or whatever. But there are other means of multiplying your messages beyond these approaches. So, as a traditional leader, I think that is one way maybe we can relate to clear.
Dr. Enin added that developing new crop varieties are major activities in agriculture. However, these viruses have constrained the production of cassava since it is a vegetative propagated crop.
As the Crop Research Institute, planting material development or development of new crop varieties is a major activity. And with cassava being a vegetatively propagated crop, we know that viruses are a major constraint to its production. So in the breeding program, I would say that in the past 10 years, all the cassava varieties that we have developed, we have ensured that they have high level of resistance to the African cassava mosaic virus, which causes the cassava mosaic disease.
Joshua Smith reports for Joy.
Still live on Joy News today with me, Daniel Dazi. Sandra Esenam Akendo comes your way next with business.